Are going live. This should be fun. Oh, we're live. All right. And we're live. Good morning, good
Good morning.
afternoon, good evening, depending on when and where you're watching this Facebook Live. This is a voice and face of Dr. Tolu Olabintan, CEO and co-founder of Livingspring Family Medical Center here in the awesome city of Mansfield, Texas. And we're here having discussions that help improve quantity of life because we believe in helping our patients live long and well. Now, if you're watching live, hashtag live. If you're watching on replay, hashtag replay. I didn't want to forget that. But I'm excited today to be talking about the topic, Doc, when should I call my doctor when my child is sick? I keep going to the ER and they send me home with nothing. And I have the amazing Dr. Andrea Wadley. And how are you doing this morning, Doc? How are you?
I am well. Thanks for having me here.
Oh, thanks for coming. I know how busy you are, and I appreciate you taking the time to do this with our viewers. Okay. Now, real quick, before we go ahead, I do want to introduce Dr. Wadley and why we chose her or picked her to come talk about this topic. She is a pediatrician, and she's the owner and head pediatrician of her practice called 127. I'm sorry, 127 Pediatrics. She's a home visit only direct primary care pediatric and lactation practice based in the awesome state of Texas, but in Colleyville. She provides convenient and quality evidence-based pediatric medical care in the comfort of your own home. I love what she does. So she comes to you as opposed to you having to come to the emergency room or you having to leave the comfort of your home. So she's going to share more about herself as we go on this show. But Dr. Wadley, welcome again, and thank you so much for being here.
Yeah, thanks again for having me. I am a pediatrician here in Colleyville, Texas. I started my direct primary care home visit pediatric practice about 4 years ago, almost 5 now. I just wanted to offer a different option for families in this area. So direct primary care means that you have predictable medical costs. So you pay me a monthly retainer. It's the same every month, and I come see your kids and I'm on call for you, and it's just a great way to do medicine. So
without the hassle of having to go to the ER sometimes. So that's awesome. That's awesome. Now, Doc, why do you do? And I agree with you, Dr. Mitra. Thank you for joining. This is a great option for patients. Yes.
Yes.
But why do you do what you do? Why do you do what you do?
So I started off my career in the hospital. I took care of newborns, which is amazing and wonderful, but it just got to a burnout sort of place, just corporate medicine in general. You've gone away from that as well. So I just honestly was just tired of working for somebody else. And the other piece of it is I just missed watching kids grow up. So I imagined my life, in pediatric training that I'd be somebody's pediatrician. So watch them kind of start as a baby and grow through the years, and you get to be a part of that. And as a newborn doc, we did a lot of great work, but we didn't get to see babies much past a couple of days of life, and then we sent them off into the world. So additionally, I chose direct care because just everything is in the Metroplex really is hospital-based, hospital-owned. So I just wanted to offer a different option for people, a smaller, more private sort of practice, I guess, more able to get to know patients. And then the home visit piece of it was because I had done babies for so long that I fell in love with breastfeeding medicine. In addition to my own breastfeeding struggles, which prompted me to get more education on that subject. And a lot of the new baby mom lactation, all that stuff is best done at your house. Like, who wants to pack up their baby and drag them to an office? Like, really no one for a while, out right after birth. So those are the reasons why I got to this place with that long name of my practice, but that's where we are. So
I love it. And as Dr. Mitra aptly put it, you designed your practice for your patients and to avoid burnout so you can be there for your patients. So it's a win-win-win-win-win all around. I love it. I love it. I love it. So let's get right to the topic. We're talking, children being sick and upper respiratory infections, right? That's a common one. And we know that the young ones, the kids tend to have these a lot. I've had patients come in and they're like, oh my gosh, been going to daycare and every week they're sick over and over again. Is there a reason why this is common? Just to kind of I guess maybe kind of normalize it for our patients. What do you think?
Yeah, so pretty young kids, so preschool age and below kids get about 8 to 10 viral illnesses a year. So if you think about that on average, that's one a month maybe. And then this past year, the season it started so much earlier than we normally see, the illness. So October, November, even September were bad for kids. And part of that is just the getting back into the norm after the pandemic. But in general, kids have the 8 to 10 per year. I just think this year it was just compacted and accelerated because of, what we had been through the past couple of years. So.
Okay, true. Why particularly kids? The adults are like, I don't get sick as much. What is unique about kids that make them more prone to them?
Yeah, so kids are developing their immune system. So, when we, us adults, see a virus, our body's most likely seen it before, or seen some form of it before. And so sometimes we can get sick for a day or two, or sometimes our body fights it off before we even know we've had it. Kids just haven't been exposed to enough really when they're young. So I tell families, you either start them in daycare and you get it over with now, or you wait till kindergarten and they miss all of kindergarten, so it's just a part of life and a rite of passage almost that kids get that. And then, as they get more and more stuff, they're more immune to it the next time they see it. So they don't get as sick very often. So I always joke that, daycare kids are pretty invincible, usually after the first year or so that they've gone to daycare. So I don't hear from them much anymore after that first year.
So it's more like a training ground.
Yeah, mostly teaching your immune system what to do exactly.
And how to help you down the line. All right. So we're still talking about upper respiratory infections. So your colds, your sneezels, your little sniffles. And so I have someone who say, well, I go to the doctor and then they tell us, stay home, give fluid, suction the nose, but they don't really give us any medicine. It's so frustrating for patients. And so I want you to kind of talk about this and because I'm sure it's easy to just give the medicine and just give some medicine and just say bye. But why is that, Doc? Why is that?
So the mainstay of treatment for viral illnesses for kids, really for anyone, is supportive care. So there's not really ever been a great cough and cold medicine available to even adults. Sometimes you take it out of desperation, but really for kids, those medicines have been shown to be dangerous and have some dangerous side effects. So really any child under the age of 5 and 6, we don't recommend any sort of over-the-counter medication. There's been good studies on honey that it actually has some anti-infective properties and it calms cough. So kids over the age of 1, we recommend honey. The majority of cough and cold is the congestion. And so that is the reason for the nasal suction and the saline and all of that good stuff. So unless there is a bacterial infection, such as an ear infection or strep throat or something like that, often we don't give any medication. We just give you advice, with the caveat that, kids can look wonderful one minute and not so wonderful the next. So, return precautions and making sure that you're keeping an eye on your child. But most of the time, kids fight off these viruses on their own, get better, and you just kind of help them get there. So.
Okay. All right. So, of course, these are medical suggestions. It's important to have an individualized care with your own pediatrician. But I wanted to highlight some of the things you said. You said supportive care. So essentially, we support the child as the child and his or her immune system is fighting off the infection. What could that be like for the parent who's like, what would you say to the parent? He's like, well, I'm not sleeping. He's not sleeping. What are tips? What additional tips? Like you're a mom yourself, so you know what these things are like. But what additional tips would you give those who are wondering, like, what other options do I have, Doc? I hear the honey, but what are other things I could do to help my child get comfortable? Because it's hard to watch my kid suffer.
Yeah, absolutely. So, one of the big things is not sleeping. And I get that. Like you said, I'm a mother too. I've been up many nights with a snotty, feverish kid, right? Or a vomiting kid or whatever. So really the main cause of most coughs is the postnasal drip. So trying to take care of that as best you can before they go to bed. So honey to soothe their throat, like we talked about. Some kids hate it just taking it straight from the spoon. You can mix it in some warm water. Saline for their nose to keep their nose moist. You can put a little, Vaseline kind of around the edges of their nose so it doesn't dry out. Then, bigger kids, you can prop them up on their pillows and stuffies, so that their head is elevated a little bit. Babies, we don't recommend that as much because, you worry about them rolling into a position that they can't get out of. But bigger kids, you can definitely prop them. And then I always recommend, and it's not completely evidence-based, but it definitely helps, is a humidifier, usually, especially during the cold winter months where the heat is running a lot in your house. The air is just so dry and it contributes to dry noses and postnasal drip and all those things. So a cool mist humidifier will help kind of moisten those nasal passages and help a little bit with the cough. And then the other piece of it is fever. So parents are rightly so afraid of fever, and it's, not fun to watch your kid feel miserable. But there's a lot of things you can do for fever besides medicine. A cool bath can help. Eating a cold popsicle or, some sort of cold food, cold liquids can help them to feel a little bit better. And then, of course, you want to do your Tylenol or Motrin if needed. If they're really uncomfortable and you can't get the fever down otherwise, you can give them some fever-reducing medicines. So.
All right, so the moms and dads who are watching who are like, oh my gosh, it's hard. These two will pass, and these are tips that you can use to help your child get comfortable as your child and his or her immune system is fighting off the infection. So you're essentially helping the child. Now, for a parent that's watching who's like, well, why don't we just give the antibiotic just in case there's a bacterial infection already? Let's just give it. Why? What would you say to that? Like, why not?
So antibiotics aren't completely benign medication. So, often you give an antibiotic and everything's fine. But a lot of kids, a lot of adults can have side effects from antibiotics, including, rashes and reactions that could potentially be life-threatening. So we never want to give a medicine that is not necessary, weighing the risk and benefit. The other thing is that antibiotics don't treat viral illnesses. So if your child's ears look fine, their throat is okay, the coughing and congestion are from a virus, the antibiotic's not going to do any good. It's just going to be, a medicine that you have to buy and give to your child who probably doesn't want to take it. And then the third piece of it is really community health. So the more often we give antibiotics, the less likely they are to work when we really need them. So, antibiotic resistance is a real thing. And a lot of places you get antibiotics, you take them, you don't need them, and then you get them over and over again. And that builds up resistance to those bugs. So
that when you actually need them, you need something much stronger and even more dangerous potentially to treat. So antibiotics are not benign medicines. And one of the things I also say is that, we have bacteria everywhere. There are millions of bacteria. A lot of them work for us in our gut, in our mouth, around our genital areas. They serve a function. When you give an antibiotic, it doesn't just go to the place where the bad bug is. It also affects the balance of bacteria. And so it can shift the immune system and cause more problems. So I'll be honest with you, it's easier to just say, here's the antibiotic. But because we're good physicians and we want to do what's best for our patients, we take the time to explain and do what's best. And that sometimes means you're not too happy with us, but we're okay with that.
We're okay with it.
All right. My next question. What is the benefit of having a pediatrician on call come out to us? I mean, it sounds obvious, but I want you to kind of speak to that, especially with young kids. What would you say to that, Doc?
So I love my practice because I get to be there for the kids. So, often a lot of things I don't need to see in person. When you have an office where, you can only have them come in and see you, you want to see them, right? But I have the ability to text with the family, and often they'll send me a picture of a rash or a picture of a viral illness like hand, foot, and mouth or something like that I don't necessarily need to see them for, as long as they're, well. And I can give them instructions over the phone. And then, of course, be on the ready. If I need to go see them, that's easy enough to do. But it really it gives parents peace of mind. So parents who choose my practice are ones who, worry a little bit more maybe, or they have a kid with a chronic illness, or they have a young baby, or they're a first-time mom, those kinds of things that they just need a little bit of extra support during those years. So that is why, I started the practice, and that's what I love about it. So.
Awesome. And for moms who are watching, sorry, I don't want to be biased, moms and dads who are watching, ask for what you need. And if you need a little more support during that different seasons of your child's life, it's okay to ask and pay for that. All right. So I hope people are encouraged. So my next question, what are some red flags that warrant an ER visit? Like what, I mean, of course we cannot go in detail with everything, but what would you say are common red flags that should prompt like, yeah, I think you should take this child in?
Yeah. So any child that falls from, decently high height, who hits their head, and after hitting their head, vomits or passes out, something like that, that is definitely a child that needs to be evaluated. Or if they have some sort of injury that involves, a high impact, like a motor vehicle accident, or, getting hit by a car while they're on their scooter or something like that, of course. And then with illness, if your kid has belly pain that just seems really severe, that they can't move, that they're not willing to go, be able to stand up or walk or anything like that, that would be something to take them to the ER for. When it comes to respiratory illnesses, really fever doesn't ever stress me out, unless your child is not vaccinated or up to date on vaccines, then that child I pay a little bit more attention to. So if your unvaccinated child's having really high fevers, that would be something to take either to the ER or bring to the attention of your pediatrician. And then staying with fever, any baby under the age of 3 months, they get on our radar a little faster, and then automatically we send any baby 1 month and under with fever to the ER for a full workup. The guidelines have changed a little bit, as the baby ages, but really anyone under 3 months we want to know, and under 1 month is automatically to the ER. Some kids can have fever seizures. Those are often times that we instruct you to go to the ER. Any sort of laceration or big injury, like a big cut on their face or, something like that, you would want to go there for stitches. They can accommodate a child a little bit more easily. What else?
You covered a lot.
Those are the big ones. Huh?
Breathing, the trauma.
Breathing, yes. Right. So respiratory illnesses, really, I start to worry about any kid that is breathing fast. So especially during RSV season. So if your baby has RSV, is breathing really fast, is not able to eat, and just looks really tired, those are babies I would take to the ER for sure. So.
Okay. And this is not an exhaustive list. These are suggestions. And of course, you reach out to your doctor for further guidance. Now, I wanted to add this question real quick. For someone who's watching who says, my child feels warm, their normal temperature is 96, 97, and so they have 98. That's a fever. Can you just address the fever issue? What is a fever?
Yeah, so I know I get this all the time too. So our normal body temperature is anywhere between, 97, 97.5 and 100.3. So 100.4 or more is a fever for anybody, for everyone, right? So I never really truly care about the number. It's more of whether your child has fever and is feeling bad, is what I care about. So, you treat the fever, you treat the child, and then they're running around playing inactive. So if they're running and playing inactive and have 103, I care a lot less than if, they're 100.4 and acting very lethargic and not wanting to get up and those kinds of things. So the number doesn't really stress me out too much. And then our normal body temperature, normally it changes throughout the day. So, you know, we're a little bit cooler in the morning and warm towards the end of the day. So if you're catching your child at the end of the day after, you know, being out and playing and those kinds of things, their temperature may be a little bit higher. Or some babies, you know, like my own child ran 99 all the time, and that was never a fever for her. So that's why we have the definition, so that we can all, you know, get to the standard of 100.4 or more. And then some kids, you know, as they're kind of marching toward a fever, their temperature will start to elevate over that period of time. But really it's 100.4. And there's 1,000,001 ways to take a child's temperature. You know, some of those thermometers are not very accurate. It's like, why even use them, right? So that's part of the other reason why I really don't care about the number. So, you know, I have a medical grade thermometer that was expensive that, you know, I use because I need to know the true number, especially of babies. But really the general parent out in the community, you just need to know whether your kid has fever or not. And then if they're feeling bad, you treat it. And if they're not, you leave them alone. So.
Okay. Awesome. Thank you so much for the advice. I appreciate your feedback. And I have people who are watching who are like, ooh, I like this doctor. She's in Texas. Maybe she can come see my child, or I can have her come speak about some of these issues concerning kids. Doc, where can people find you?
Yeah, so I'm on all the things. So I'm on Facebook, Instagram, of course, my website. If you do 127pediatrics.com, you can get to me most of those places. I am taking new patients in the Colleyville area, but I'm taking babies right now, just my part of the practice. I also have a associate in Aledo who is taking all ages. So if you live out that direction, we would love to take care of your children. And then I'm working on online breastfeeding medicine education center. So I have a class that's due to be available to the public soon, and we'll let you know about that. But yes, 127pediatrics.com will get you to most of those places.
Awesome. I'm going to put that on towards the end, anytime from now. We'll put that on so people have an opportunity to connect with you. And please let me know when that course is out, so I can also share on my platform so people have access to that as well.
Yes, that would be great. Thank you.
Oh, you're welcome. Thank you so much for coming here. And oh yes, the information is already up. Thank you for watching. Sorry, I can't see your faces as far as who's watching and who's not, but please carry is sharing. So be sure to tag forward this video. If you're on YouTube, thank you for watching as well. Share with all your friends and their friends. Okay. That being said, if you or anyone you know is looking for a thorough family physician who's caring and also committed to helping you live long and well in the Mansfield, Texas and surrounding area, I am she. Thank you all for watching and have a good one. Thanks, Doc.
Bye. Thank you.
You're welcome. All right. All right.